push up. Okay. Now with your dominant hand, you have to slide it or glide it along the right costal margin. Ready? Can you please take a deep breath? Okay, relax. It's not palpable. Okay, the border is not palpable. Now, for the spleen, okay, again, just reach over 11th and 12th ribs, push up. Okay, this time, this way. Okay, palpate now the margin. Okay, and ask the patient, can you please take a deep breath? Oh, your abdomen is getting angry. Okay, again, it's not palpable. That's why we do the auscultation first. Can you imagine if that happened earlier? Okay, so for the kidneys, by the costovertebral angle, push up just below this horizontal line along the umbilicus. Take a deep breath, hold. Relax. And one more. Hold your breath. And not palpable. Okay, so in some patients, like we said, you may be able to palpate the border of the liver, then you need to assess its consistency. Sharp, sharply delineated from the rest, it's going to be firm, no tenderness, and the spleen, not palpable at all. For the kidneys, it's going to be the right that's more prominent. It's going to be just the upper pole of the kidney. Okay. Then we now do our special tests. So let's pretend our patient has ascites. So protuberant abdomen. We said the first thing that we need to do will be to assess the abdominal girth. So we always say, measure it at the same time every day. It's not, oh, I want to do it in the morning. Oh, I forgot, so I'll do it tonight. Okay, it has to be a more regular schedule, and we recommend that the same person who took it yesterday will be the same person who will measure it today, so that there is one landmark. So if, let's say, we use the area along the umbilicus, then that's going to be the landmark that's going to be used. Okay, now, if, like we said, you have ascites, more than 500 ml of fluid, you might think it's a lot, but it's not really. Okay, for the fluid wave test, you ask the patient, may I borrow your hand? Put your hand this way. Okay, now just put your other hand here and then tap. Okay, don't need to slap too loudly. Earlier they kept, I said, that hurts. Just gentle. Okay, if there was fluid, the fluid will be felt all the way to this other hand. If, for example, thank you, you have someone who has a protuberant abdomen, it's because of fat. Okay, I had a student, he was saying, oh, Dr. E, see, there is a fluid wave, because he was really fat. And I go, no, because the fluid has to be felt all the way here. You can see the ripples on his abdomen, but it's only on this area where you tap it. If it's fluid, the rippling effect will be felt all the way here to the other side. Okay, so that is the fluid wave test. Now for the shifting dullness, we again percuss. We percuss from the umbilicus all the way to the lateral. Okay, now you will hear a change in the tone, so you have to mark it. There you go. Okay. So, in a patient who has ascites, the fluid, when the patient is lying supine, fluid will be all over the abdomen, correct? Now, when we ask the patient, can you please turn to your right? Okay. In a patient with ascites, the fluid will now gravitate towards the dependent side, correct? Okay, so what happens now? The air fluid level will be heard higher, closer to the umbilical area. And so when we do our percussion again, you will hear the change in the tone very close to the umbilicus. But since she does not have any fluid, when you percuss, you will expect the sound, the change in the tone, to be heard at the same area which you marked earlier. So this is the shifting dullness. Okay, right? Now we do our what do you call this? Tests, special maneuvers for appendicitis. So we said, okay, McBurney's point. Okay. For example, we palpate. Okay. And when we lift our hand, that is the time the patient says, "Ow." Okay. So that is Blumberg's. For Rovsing's, we palpate on the left, but the patient feels the pain on the right. Okay. Now for the psoas, can you please keep your knee straight, lift it up, lift your right leg. Okay. We apply pressure here on the thigh. Resist, please. Any pain? No. Okay. So normally, or not normally, in a patient with APP, when you try to bring down the leg, they will feel pain on the right lower quadrant. And for the psoas, the obturator, ask the patient, can you please bend your knee? And then bring it closer to your chest. And we bring the knee in and out. Okay, any pain? No. In a patient with appendicitis, again, there will be pain on the right lower quadrant because of the stretch of the muscle. Okay. So that is for appendicitis. And then we have the tests for asterexis. Cholecystitis. So for cholecystitis, okay, just put your finger, might be just the thumb, or just the, the palpating fingers below the right costal margin. Can you please take a deep breath? When the patient takes a deep breath, that's when you palpate deeper. Okay, any pain? Okay. So again, in a patient with cholecystitis, when you ask the patient, hold your breath, and you palpate, deeper, the gallbladder will now be in contact with the palpating fingers. It will elicit pain, and the patient goes, and that hurts. Okay, that's a positive Murphy's sign. Okay, and the last is the asterexis. So just stretch your hands. Okay, both please. Okay, and then dorsiflex the wrists. Okay, so you will note for about 15 seconds any tremors. So normally you will not observe any movement of the fingers. In a patient with asterexis or because of hepatic encephalopathy, you will now see the fingers exhibiting very light tremors. They're like flapping. Okay, so that is asterexis, positive asterexis. She does not have that. Okay, so these are the different assessment tests for the abdomen. Questions? Okay, we always keep in mind that when we palpate, the area which the patient claims is painful, that's the last area that you need to palpate. And you do not keep repeating, let me see again, let me see. I don't think I elicited it right. Okay, you do not keep repeating. You have to be very careful when you're palpating the spleen and you're considering splenic enlargement, because the spleen can rupture. Okay, and that's going to be very, very bloody. That can cause the death of the patient. Okay, any questions? Okay, so you practice until